The MEDIOLA study is a phase 2 trial investigating the use of Olaparib, which is a PARP inhibitor, in combination with durvalumab, which is a PD-L1 inhibitor, in BRCA1 and 2 mutation carriers with metastatic breast cancer. So the rationale behind this is that we know that there are high response rates to Olaparib in BRCA1 and 2 breast cancer. The OLYMPIAD trial showed a 60% response rate. And the hope is that the addition of an immune checkpoint inhibitor would potentially expand those durations of response and lead to improved progression-free or overall survival. So this was an initial phase 2 trial to just see about the safety and potential efficacy of the combination. It's a relatively small trial with 34 patients. The response rate was 63%, but there were some encouraging signals in terms of duration of response. That is, once you have a response, it's possible that it could be prolonged in combination with durvalumab. The study is really too small to give any exact clues about this, but we saw that response rates, for instance, were higher in patients who had had either no or just one first-line therapy, with a response rate of 70%. And similarly, there were an improvement of duration of response and progression-free survival in earlier lines of therapy as well. Well, the hope is that we can obtain more data and start to narrow this down. Again, this was a heterogeneous population. It allowed for more lines of therapy, and we also don't know the best biomarkers. So an initial analysis wasn't clear that there was a particular biomarker that would predict response to the combination. But again, small study, so we still have work to do. The nice part about breast cancer is that we have 2 PARP inhibitors, both Olaparib and talazoparib, that are active in metastatic BRCA1 and 2 breast cancer. So there's a lot of work in this field, first of all, to see whether you can expand the group of breast cancer patients for whom these drugs would be indicated, whether or not that's mutations in other homologous recombination pathway genes, or whether or not there's HRD analogs in breast cancer like there are in ovarian cancer. By the way, it's not clear that they're completely interchangeable, so we really have work to do there. So that's one clear area. There's a lot of interest also that in BRCA1 and 2 mutation-related breast cancers, although these drugs are terrific and in both studies showed improvement in quality of life compared to standard chemotherapy, the progression-free survival is not as long as we'd like. Resistance mechanisms developed. So we have to understand the resistance mechanisms and try to overcome them. There's a lot of work with combinations, so this is one example, a combination of a PARP inhibitor with immune therapy, but there's a lot of other combinations that are being studied to see whether we can do better with what we've got right now.